Alright, hi everybody. It's Dr. Monalisa Muchatuta, or Dr. Mona, like everybody calls me at work. Just logging in just to kind of give you a little update since the last time. Send out a video just to kind of catch up and maybe touch base with everybody with sort of what's been going on. As you all may already know, New York City, where I work, has literally gone through the ringer with COVID. We saw, it's unexplainable what we saw. I mean, people were dying so fast, and I'm an emergency doctor. This is what we trained for, and we're ready for these hard days, but never seen people die this fast. But, I'm not making this message to be alarmist. I'm saying it decided to make this video just to sort of give you some good news. Today is April 22nd, and, we've started to see a slowdown in the number of new cases in New York City, which has been really promising. We are exhausted, we're tired, and those of you that follow me will know that I also recently tested positive for COVID-19. But I'm well. I had symptoms starting about 2.5 weeks ago, actually. I had a sore throat. I had some just generalized tiredness. I just felt not like myself, but, we're working a lot. And I just thought, maybe it's just from all the shifts that I'd been working. And doctors are the worst patients anyway. So I kept working, never had a fever, and I never really actually started coughing. And then it was just a day, and I have seasonal allergies and the seasons were changing, so I thought perhaps that was what was going on. Maybe a week later, I started having some abdominal pain. I'd say 3 out of 4 type localized in my left lower quadrant, which was bizarre to me because I've never had that type of pain before. A couple of days later, I started having non-bloody diarrhea, which I was just like, I don't know what's going on. And also I'd been to see my doctor who would prescribe me some antibiotics thinking that I had maybe a colitis. So I just thought perhaps the diarrhea was coming from the antibiotics that I was taking. About a couple of days after that, I was at home making my toast to go to work right before my shift, and I burnt the toast completely, and that's when I realized I couldn't actually smell anything. I went to work that day, told my boss, and I got tested for COVID. The next day, my COVID result came back positive. Literally all of these symptoms, which are not the typical symptoms that you would know of, were probably COVID, and the only thing that finally took me off was the lack of smell. It's been about a week and a half now I've been at home. I feel fine. I think I wasn't feeling 100%, and I've just kind of been resting at home, doing all the same activities that social distances have been doing, but sleeping and resting a little bit more, and I definitely feel like I'm getting closer to feeling 100% myself. I know other people have had symptoms where they've had body aches, coughing, chest pains, and shortness of breath, which are the more serious symptoms. I never had those. So I'm thankful that I'm probably one of the milder COVID cases. But I feel fine. So I made this message just so people would realize that, majority of people that are going to encounter this disease are actually going to have mild to moderate symptoms, and we will recover. Some papers say up to 85% of people will have very, very mild symptoms. The mortality rate right now is documented anywhere between 0.5% to about 3.5%, meaning about 3.5% of the people that get COVID will die. 3.5% of people that get COVID will die. So this means there's 96.5% of people who get it will do okay. And, I feel like there's a lot of anxiety, a lot of stress, a lot of nervousness and fear around just having a diagnosis of COVID. I have COVID. This is what COVID looks like. Idris Elba had COVID. Boris Johnson had COVID. So many people had COVID and recovered. Babyface had COVID. So, you know, just embrace it. This is what's going on. COVID is everywhere. And I think sometimes wellness is in your mind too. Just remember that, right? So you stress yourself enough to where your immune system is battered or your immune system is shot. You're really not giving yourself the best opportunity to do well. So I want to say I have COVID and I recovered. I'm a COVID survivor, I guess, if that's what you want to call it. But this is supposed to encourage you to not be anxious. Try to stay at home still, because people like me that have these mild symptoms can take it for granted and then go out and spread it to others. So stay well. Just wanted to update you guys, just let you know that all is well. I contracted it, but survived and recovered. I have 3 more days before I go back to work. And we'll be seeing you soon. Okay, bye.